Hi, everyone. My name is Amelia, and I will be the moderator and stater for our debate. I've been in ABA for about a year.
Hi, everyone. My name is Lizzie. I've been in ABA for about 5 years now. I'll be the pro-approver for this debate.
Hi, I'm Rebecca Dunehouse, and I've been in ABA for about 3 years now, and I am a pro-choice attacker.
Hi, everyone. I'm Logan. I am the Con4 Rehabilitation Prover, and I've been in ABA for about 6 years now.
Hi, my name is Krista, and I am the Con for Habilitation Attacker, and I have been in ABA for about 3 years now.
The topic discussed will be the right to personal liberties versus the need for habilitation. So Lizzie and Rebecca will be arguing for pro-personal liberties. Personal liberties are the liberties of an individual to act freely or at their will, as long as they do not break laws set in place to protect the welfare of others. Examples of this are the right to marry and start a family, protection from discrimination, and respect for family and private life. Krista and Logan will be arguing on the con side for the need for habilitation. Habilitation refers to the process of helping individuals with disabilities improve daily living skills, or sometimes motor skills, in children. An example would be a child with autism participating in speech therapy to improve their pronunciation of their S sounds. Questions we want to ask before the debate are: does focus on personal liberties and habilitation create liability issues for service providers? And does habilitation infringe on the right to personal liberties for an individual with disabilities? Can this change from childhood to adulthood?
So our statement of purpose: necessity for individuals with disabilities to receive treatment and habilitation is this: all people have personal and individual rights that are protected by the Constitution and various amendments and legislative acts within. The purpose of this debate is to highlight the argument and conflicts between those who believe habilitation and intervention is a certain requirement and those who believe that personal choice and liberties supersede those of needs. Our key points that we're going to be going over today relate to the Constitution, the Patient's Bill of Rights, BACB ethical codes, and then the patient choice and treatment options. Next slide, please. So we're going to start with the Constitution. We're going to focus mainly on the First Amendment. This amendment focuses on the individuals have the right to have religious beliefs, and a rehabilitation therapy or procedure is against those beliefs. They cannot be forced. Clients and participants also have the freedom of speech. Families and individuals with disabilities should be able to have choice and make those choices for themselves within reason. Next slide. Next will be the Patient's Bill of Rights. We're going to focus mainly on these three: Patient's Bill of Rights, the right to be treated with respect. This is going to be considering to be safe, considerate, and respectful care provided in a manner consistent with their beliefs. The right to make a treatment choice, which is the right and responsibility to know about the options available for treatment of medical conditions and then make the choice to see what would be their best fit. This right is closely associated with the right to informed consent. So having providers give out options to participants, not just giving a one-size cookie-cutter fit. The next Bill of Rights would be the right to refuse treatment. The client has the right to refuse to participate in research, to refuse treatment to the extent permitted by law, and to be informed of the medical consequences of these actions, including possible dismissal from the study and discharge from the clinical center. If discharge would jeopardize your health, you have the right to remain under clinical center care until discharge or transfer is medically advisable. Next slide, please. And lastly, we'll go over the BACB ethical codes. We're going to focus on 2.09, which is treatment intervention efficiency. This ethical code focuses on additional factors and choices may be considered in selecting interventions, including but not limited to efficiency and cost effectiveness, risk and side effects of the intervention, client preference, and practitioner experience and training. So for example, if you are working on FCT, functional communication training with a client, whether to go with a PEX board versus a AAC device, PECs are normally about $50 to create and very inexpensive, whereas an AAC device can be anywhere from $200 to $600. The next BACB ethical code we're going to cover is 303, which is the Behavior Analytic Assessment Consent. Before conducting an assessment, all procedures must be explained to the client or caregiver, as well as written approval must be submitted before moving forward and implementing the procedures. So to elaborate a little bit more on this ethical code, we need to explain in depth why we are there, our purpose, and then the end goals for the client's treatment. We also need to have a written approval sign saying that they approve of this treatment plan and we can move forward. For 4.02, this covers involving clients in planning and consent. The client should always be involved in all planning and give consent to any changes in their program, as well as 4.04, approving behavior change programs. This kind of goes a little bit more in depth that 303 and 402 are going over. This code states there must be written approval before implementing any changes to the client's program. Again, this is giving that written approval, written consent to move forward. Next slide.
So I'll be going over the statement of con. So the necessity for an individual with disabilities to receive treatment and habilitation is the same as those who have the need for education or other rights. There are many laws that have been put in place to ensure that those who have disabilities are able to learn and become as independent as possible. The purpose of this argument is to show that habilitation is a necessity for any individual who qualifies to live their best life possible. Some of the things we'll be focusing on is the right to treatment, inclusion within society, the good individual, and the habilitation does not deny liberties. Next slide, please. So the right to effective treatment is a right to all individuals who qualify for their services. Vitt and Houston has stated the purposes of ABA services in that applied behavior analysis has so many different applications for those who are in need of the services. It is an obligation of a behavior analyst to help others learn to exercise their rights, just like the rights of the Constitution are defended for those who don't know them, who don't understand their rights. So just like was stated earlier, the Constitution provides rights for those who wish to exercise them and for those who don't wish to exercise them. And it is our obligation to teach them and defend those rights as well. So each person who qualifies has the following rights. An individual has the right to a therapeutic environment. If the environment is something that is not therapeutic and helps them grow, then it is not going to be successful and lead to possible refusals, which means that there needs to be a change. An individual has a right to services whose overriding goal is personal welfare. Each person who wants to improve their life has certain goals in every aspect of their life. And those goals, especially with intervention, needs to be through that habilitation and written and planned carefully. An individual has a right to treatment by a competent behavior analyst. Maybe sometimes there's a refusal because a plan hasn't been implemented properly or there's more information needed to help an individual client. And in that case, there are networks and individuals who we should be able to reach out to that can assist us. An individual has a right to programs that teach functional skills. So we're not here just to teach them to identify red and blue, although that is an important skill, but to learn how to make food for themselves, to go to the bathroom, to do things that everyone generally needs to be able to do by themselves. An individual has a right to behavioral assessment and ongoing evaluation. A refusal is not the end of the road. A refusal can be noted and can come back to at a later date. If someone has refused services, that's fine. Let them have their time and continue that evaluation of their needs as time goes by. It doesn't mean an end of services. It means an end of the session or possibly an end of the current intervention. An individual has a right to the most effective treatment procedures available. Again, if the correct treatment procedures aren't available or aren't being implemented correctly, it can seem like a punishment or it can seem like it's not effective. So it is our obligation that we network and help those around us to have the best plans possible by interacting with those around us. Next slide, please. So another example of inclusion is school and no child left behind. So school is aversive to most children, and yet we require them to attend. Most students, if not all, say they hate school at some point. But as teachers, parents, and citizens, we know that going to school or monitoring schooling in the home is beneficial. So just like those who go to school, I know I personally stated multiple times, I hate school. But still, my parents insist that I go to school. I gain an education. I gain skills that allow me to function as a human adult, as an independent. So not only are that we're required by federal law to attend, there's another law enacted to ensure that children who have struggles receive the services they need in school, called No Child Left Behind. And the statistics for the educational progress exams or students with disabilities before and after a year of No Child Left Behind shows increase in understanding and benefit to the children. So not that there isn't a choice, but it's the fact that if there's a requirement for learning and understanding, then there is obviously things that everyone needs to learn and everyone needs to understand. And habilitation is on that same level. There are skills and abilities that everyone needs to be able to utilize and understand in order to be successful in life. Next slide. Next is, I want to go back to the behavior code. 209 states clients have a right to effective treatment. As stated earlier, if the treatment isn't effective, it could be a punisher just to be in that location. Based on the research literature and adaptive to the individual client. Behavior analysts always have the obligation to advocate for the education of the client about scientifically supported, most effective treatment procedures. So we always have an obligation as ABA practitioners to assist our clients to understand what they are doing, what they are learning, how it will help them, and guide them in that path of learning. It's not a say no and it's the end of the road. It's a progress of no to this treatment. Let's try something else. Let's talk to someone else. Let's talk to an expert and get down to how we can help you the best. Behavior analysts have the responsibility to advocate for the appropriate amount and level of service provision and oversight required to meet the defined behavior change programs. Maybe if too much stimulus is at a facility, don't go to the facility, or don't go to the community, or stay in the home, or come out of the home and go to a facility. There are many changes that can happen that will facilitate habilitation, but not interfere with a person's right to choose. And 406 says behavior analysts describe to the client the environmental conditions that are necessary for the behavior change program to be effective. The environment is crucial for the increase and change of our clients who need to learn and progress in order to become their own functioning individual. And if the environment agitates them, then they need to have that environment changed. Next slide, please. The good of the individual and quality of life. So a study by Fresnel et al. In 2016 studies the effect of intervention on 71 different children with 3 different intervention types. So I like to point out, this is not one intervention type. This is multiple types in different circumstances and settings. And the main finding of this study was that the type of intervention was not critical for outcomes of the adaptive and global function, according to results of Vinland Adaptive Composite Score and the CES. The point is that no matter the type of intervention, there was a measurable improvement in these children, improving their quality of life for themselves and others around them. The exact point of habilitation is the same as any parent or teacher, to teach their learners the necessary skills and information that will allow them to be an individual in their own life. So it doesn't matter the level of habilitation. It could be once a week. It could be one skill, one goal once a week. And that's all they can handle right now. But there will be improvement. It could be one step at a time, and it can help our individuals and learners be better, be who they want to be. Next slide, please.
So I will be discussing more points about pro-choice. One of the options is having the options to choose. So individuals who do have disabilities still have the same rights as others. Individuals have a right to proper medical care, education, standards of living, and exercising their rights to refuse these options as well. An example of this is people refusing medical care. They can sign an AMA form. This is a right that should be used to refuse different types of treatment or therapy if the individual or parents do not see that it will benefit them. Individuals and their parents have the right to refuse habilitation. They have access to it if they want it, but they have the right to choose different treatments or no treatment at all. This isn't because they don't want it, because they are lazy or they want to do something else. It's because they may not believe that the treatment is effective, or it could be against their religion or morals. There was an act passed in 1988 which requires staff to give clients options for treatment. This means that the patients weren't given only one treatment, but multiple options for treatments if needed. Patients were given a voice and were not forced to choose. Individuals with disabilities should be given all different options on habilitation, including being able to refuse it. Next slide. Allowing choices. Exercising one's choice may prepare them more than someone who is not allowed to make their own choice, that is forced to do something. This prepares individuals with disabilities to live in a community where they are expected to make choices and have decision-making skills. It allows them to live as normalized as possible on their own terms. Allowing choices from a young age can prepare individuals to make harder decisions as adults. If children are not allowed to make options and options that they can deny or refuse, it will not prepare them for harder decisions to come. Individuals with disabilities should be aware of the different choices they are able to make. Therefore, giving choices to children for reinforcement, consequences, or preferences can help them prepare them to make decisions in the future about their home and work lifestyles. Being able to have the right to use their personal liberties to refuse or take advantage of the type of habilitation they want. Next slide. Compliance. Researchers also found that participants prefer to be able to make choices for themselves. Individuals are more likely to participate in activities when there are more opportunities to choice when it's available to them. Researchers found that children were more likely to discuss with their peers what the consequence would be for each other than have the teacher choose the one consequence. The children were able to discuss different options for each other that were appropriate. The children were then able to have that option and choice. Another study discussed by Bannerman et al. Is that women had a better attendance at a gym when they were able to choose their workouts versus women who were assigned a workout routine. The women were more motivated and had a better attendance when they were able to have choices available to them. Individuals will be more motivated and to make an appropriate decision when they are given options and not forced to do something they do not agree with. Next slide. Individuals perform better when there is a task where options are available to them. This study found that children were more successful when losing weight when given options on how to versus individuals that were given an option for them. Individuals learn in different ways, so there should not be a standard forced option for everyone. This includes individuals choosing treatment and not treatment forced on them. Another study discussed by Bannerman et al. The study had undergraduates choose words to learn and define. The students were able to choose the words and then learn them. They were able to learn them more accurately than the other students who were forced to learn the words that were given to them. Between these studies, the two studies, the performance level was higher when individuals were given options to choose from. The studies allowed individuals to use their personal liberties to choose something that they agreed with and was successful at it. Individuals with disabilities can be more successful and have a better quality of life if they choose rehabilitation or not, with different options given to them. Next slide.
Habilitation doesn't deny personal liberties. Habilitation helps individuals understand the choices that they're making. So habilitation and personal liberties don't have to be conflicting. Choices are something that can be integrated within habilitation. And service providers should work hard to provide choices within habilitation. In some cases, though, choice is something that needs to be taught. So a curriculum should be provided to teach a client how to make choices. And service providers should be well trained in areas of choice and are competent in providing opportunities for choice. And staff members must make, they must be motivated to provide opportunities for choice. Next slide. So teaching choice is something that is important in habilitation. Those who don't have the skills or don't understand consequences would require teaching before they would be able to choose. Chevin and Klein said that in the profession of ABA, there's been focus on choice making as a permissible activity, rather than a teaching target. So we just assume that being able to make a choice is something that everybody just knows how to do. When there are cases where teaching to help discover what preferences are and to learn to make choices is something that needs to be put into a teaching program. So giving a client a choice during activities can make a difference, but they might need to learn what their preferences are to be able to make responsible choices. Next slide, please. So as a skill, it's something that needs to be practiced or used. The amount of choices that a person can make depends on how many opportunities they're given to make choices. So initially, if you're working on a program in a habilitation setting or with service providers, the opportunity to make choices has to be planned until making choices becomes natural during interaction. So creating environments that are option rich to be able to make choices is important. Teaching, giving the client options for which skills that they want to learn can help build up their behaviors and their behaviors that you're wanting to increase also and skills that they want to learn. Choices need to be taught in different ways for individuals to understand the choices that they're making. So even simple choices of what they want to eat can make a difference to a client, or making sure that we're using preference assessments to see what they're interested in and use that as a guide in how you continue to teach. Next slide, please. Reiterating the ethics codes that were stated earlier in habilitation. Habilitation respects individual rights for choice when you're following the compliance codes. Ethics Code 2.09 states that a behavior analyst has an obligation to advocate for and educate the client about effective treatment procedures. So it is our responsibility to teach what a good treatment plan looks like. Also, Ethics Code 4.02 states that we're to involve clients in planning and consent. And 4.04 says the behavior analyst has to obtain written approval before implementing programs or making changes. Next slide.
So looking back at questions asked in the beginning, the first question was, does focus on personal liberties and habilitation create liability issues for service providers? Personal liberties give individuals the right to choose, making those individuals liable for themselves. And the second question was, does habilitation infringe on the right to personal liberties for individuals with disabilities? Can this change from childhood to adulthood? Based on points made from the pro and con sides, children under 18 who cannot opt out of services may have their personal liberties in question. Adults can choose if they would like to remain in treatment programs. And to conclude, their right to personal liberties is not always reflected by the US Constitution for individuals with disabilities. Habilitation has been implemented increasingly for those individuals, creating some controversy surrounding the topic, with concerns that individuals are being suppressed from exercising their rights due to lack of formal protection. However, habilitation can provide an improved quality of life and help with learning functional skills to gain independence. Individuals can be given the option to make choices in their own habilitation plans. And then moving forward, we just have our references. And thank you guys for watching.